Hello, my name is Rachel, and I did my project on motivational interviewing and couples therapy. So how did motivational interviewing begin? It began in the early 1980s with William Miller and Stephen Rollnick, and it was adapted from Carl Rogers' concept of patient-centered therapy. Initially, MI was utilized to help with substance abuse issues and has been quite successful. So why is MI so effective? It is designed to provide the client with engagement, empathy, respect, dignity, autonomy, control of their own goal-making, and collaboration and support from their therapist. My favorite aspect of MI is that clients make their own goals. Clients tend to be more adherent to goals that they create with their own resources and skill sets in mind. While MI has primarily been used for individual therapy, there are other types of therapy that could be effective in, such as couples therapy. There's a lot of research available on couple-partnered therapy not using MI. So as an example, I found one study for couple-partnered therapy where both couples were to abstain from alcohol and go to therapy together. It was found that couples who used we and our language were more successful in attaining their goals than couples who used singular pronouns. So MI is a successful tool, and supportive couples in therapy yield better results and outcomes. So why not combine both? In the two papers that I found on MI and couples therapy, both of them mentioned how effective MI has been with individuals and that MI has been completely overlooked as a tool for couples therapy. It is necessary for MI to be used as a primary tool in couples therapy, not only for the success that we have seen in the individual, but as a template for positive, empathetic, and respectful ways to communicate more effectively. It can also show the couple how to work together as a team to solve their own problems. Seeing an example of MI as a communication style can translate to good communication habits as a couple. Regretfully, there is little literature on MI for couples. There have been a few studies discussing MI for families dealing with a family member who has had substance abuse issues, and it was called systemic motivational therapy. So I did find two studies using MI in couples, and the first one utilized motivational interviewing for gay male couples to discuss the dangers of substance abuse and protection against HIV. This was decided because in the literature there has been a lot of success using MI with individuals to reduce the risk of HIV with casual partners and reduce the incidence of substance abuse. They recruited 20 couples, 40 individuals from ages 18 to 29 who received MI for 3 sessions. In the paper, they give examples of a question and answer session from one de-identified couple. The MI basically went the same way that it does with individual MI, except the therapist was responding to and reinforcing the values of each individual person in the couple, even when the couple disagreed on some topics. So, as far as the data discussion and conclusion went in this paper, the researchers decided that this study was an attempt at a theoretical framework for future clinical practice. So, essentially, there was not any data analyzed. They just decided that the study went well and that there needs to be more studies like it. Funny enough, 2 years later, the head researcher in that study decided that another paper needed to be put out analyzing the MI fidelity on the 2018 study using Motivational Interviewing Treatment Integrity Coding Manual, or the MIT. They used 4 coders that used the MIT, and they reported that they had great scores for the interviews that were taken in 2018. They reported that the MI and the MIT worked very well. The 4 coders had exact agreement on many of the parameters and nearly exact agreement on the other parameters. And so here was some of the data that they were the most pleased with. The MIT data was assessed through SPSS version 25 as a 2-way mixed effects with high agreement. Once again, the conclusion was that there needs to be more studies using MI with couples, not only because it is an effective therapy tool, but because there needs to be more data out there for evidence-based practice. One of the limitations of the study is the initial study was a preliminary investigation of MI therapy and couples therapy to see if it could be effectively done, and the second study or paper was to validate the MI interviewing data. The study needs to be replicated for reliability and consistency. So the second study that I found was conducted in Irma, Iran, using motivational interviewing on couples discussing the danger of secondhand smoke on a pregnant wife and smoking father in the home. This study was performed on 112 couples, each couple dynamic included a non-smoking pregnant wife and a smoking husband. They were divided into two groups, 56 couples. Both groups were given an identical pre-test at the start of the study and a post-test 4 weeks later. The questions on the test were to determine how often the wife was exposed to secondhand smoke and the duration of smoke exposure the week previous. The control group received no intervention, and the intervention group received 90-minute MI sessions twice a week for 4 weeks. The data was collected from the pre-test and then 4 weeks later during the post-test. The data were analyzed using a repeated measures analysis of variance, or ANOVA, and the MI intervention group had a significant difference in the duration and frequency of smoke exposure from the baseline data in the control group. And here is the data where it shows that both the intervention group did better after the 4 weeks and also did better than the control group. So the MI for couples in this data had significantly reduced exposure of smoke from the men to the pregnant women. The authors compared this study to another study that used individual MI on just the pregnant women. When the data from these two studies were compared, the results in this couple's MI study reflected more significant results than the results in the individual MI study. The limitations for this study is that more research needs to be conducted on a diversified population to show the repeatability of the efficacy of MI with couples. This study in particular was obtained, its participant pool from public health centers in IRMA. Another limitation is that the study is a self-report and the participants may have some variability in the actual duration of exposure versus their estimated duration. So implications for practice. For social workers, there needs to be more research on this topic. It is important for us to use evidence-based practice in our work, and unfortunately, there's not a lot of evidence. In all of my searches, I just found these two papers on MI with couples. For the population, the primary reason is MI is an effective tool to create positive change. The secondary reason is, as I stated earlier, MI has an empathetic way of respecting and supporting the client. This is a great example of positive communication. It may be difficult for clients to communicate effectively and respectfully if they have not seen an example of this in their own upbringing. Seeing how the therapist communicates with each individual and respects their agreement and disagreement on topics can also be a good experience and a good example for clients. Motivational interviewing has been effective for individuals with substance abuse issues. It is time for MI to be more widely utilized in therapeutic sessions. It seems like we have a great tool to use and it's often neglected in other modalities.